And as per my understanding is that there are a lot of issues that you cannot even do anything in a surgery.
Yeah, I mean, there are conditions that are just, patients that can have a bad condition, but they might not even be an operative candidate. It's
Right.
not to say surgery couldn't potentially help them, but when I say non-operative candidate, I mean I'm not a surgeon, but those are cases where the surgeons feel, it's too high risk, or there's not a great chance of a good outcome, or it could be, risky for the patient, or there's not just good evidence to support that surgery is going to help them in the long run. Because surgeons also have data and do research, and they like to, outcomes are important to them as well, and they want to make sure that the types of surgeries they're doing also make sense and are helping people. So people in regenerative medicine, certainly, there can be this misconception that we're against surgeons or patients going to get orthopedic surgery. And that is not the case. There are unfortunately some patients that we have to turn away. Not that we want to. We want to help them, and in some way we still do, even though we're not able to treat them. They're coming in, and where I work, we don't charge just for an initial evaluation to come and talk. But there are cases where it might be their first stop, and they don't know any better, but they have a condition that is surgical only, and we can't help them. And maybe we help them with the diagnosis, or make the diagnosis for them and guide them and say, hey, this is what we think you have going on, and we can't help you, but here's what we think you need to do and probably have done. And so we really just want to help people make the best decision, regardless if they choose the regenerative medicine route or want to go the surgical route. But for instance, someone with a full rotator cuff tear, where they've completely torn, they have a complete full tear of their rotator cuff to the point where they cannot move their arm at all away from their body. It is just so bad. That's not to say that doing regenerative medicine couldn't work on that patient. It's just not very likely. And that patient, we know, is more likely to get function back and benefit from surgery, just because we have more data and information on that. So that wouldn't be a patient where I'd be like, oh yeah, let's try this regenerative medicine. We have a pretty good likelihood we think this is going to work for you. That's one where we say, well, there's a chance regenerative medicine could work for you, but like really it's kind of like rolling the dice, and we really don't know how great the odds are. But we know that a lot of people who do this go get surgery, and they're that helps. So go get surgery. There is also times when doing regenerative medicine can help after a surgical procedure, after somebody gets it, and there are some surgeons that will actually use OrthoBiologics intraoperatively, where they will be doing a surgery, but they will also inject, platelet-rich plasma, or perhaps bone marrow aspirate concentrate in there, or maybe some type of cellular or biologic graft as well.